is Professor Lisa M. LaPerouse, PhD and Director of Research for the Inclusive History Project at the University of Michigan Flint. She is also a professor there. Thank you, Lisa, for joining us today. You've done some extensive research in the area of health inequities, particularly among the Latino communities. And I'm sure there's a lot of angst among people in the Latino community about this planned mass deportation effort. And many of those living in mixed status families are wondering if this effort will reach them. So describe how it's impacting the community.
First of all, thank you so much for having me. I think, as with the last Trump administration, people are terrified, and they're making plans for worst case scenarios. So they are meeting with lawyers, just like they did with the last administration, making preparations for their minor children should they be deported. In the United States, approximately 4.4 million U.S. born children under the age of 18 live with an unauthorized or undocumented parent.
So those 4+ million children are in jeopardy of being separated from their birth parents. Is that the case?
Correct. So families will be faced with a tough choice of figuring out if they are deported, if their children will be coming along with them, or if they will have arrangements to stay here in the United States as they are citizens.
Professor LaPerouse, you've spent more than a decade documenting how systemic racism and social injustice have resulted in health inequities for the Latino community and other communities of color. Tell us what your research over these years has revealed.
So to put it simply, racism is deleterious for our health. Racism is a chronic stressor that causes wear and tear on the physical and mental health of individuals. This can include everything from sleep difficulties and psychological distress to hypertension and premature death.
And talk very briefly about what, if anything, your research has shown you about how an effort like this mass deportation could impact those who witness it and may not be directly involved.
Yeah, so there's actually quite a bit of research that's talked about the fact that although individuals may not be undocumented themselves, that the anti-immigrant sentiment, the political environment can have deleterious effects on people's health. So regardless of your immigration status, you may feel the stress and worry, which again takes that wear and tear on the body. There's actually a few studies that have looked at the 2016 election and its impact on premature birth. And what they found is this was a study of millions of births across the United States. Mm-hmm. And what they found was that the 2016 election had negative effects, and there was an increase in premature birth among Latinas. And this is something that has been also seen when the Muslim ban in I believe that was 2016 was enacted. So there was also research that was conducted that found that people that were from Muslim sending countries in the United States experienced preterm birth. And why preterm birth is typically looked at is because it is a good marker of trying to understand acute stress and its impact on the body. And the way that it disrupts things is it can cause elevated inflammation, immune dysregulation, and cortisol levels. And there can be a number of complications with this. Preterm birth is a leading cause of infant mortality. And so it's very problematic and troublesome that just exposure to the environment and the rhetoric can cause such harmful effects to mothers and their babies.
Lisa LaPerouse, PhD, Director of Research for the Inclusive History Project at the University of Michigan Flint. We sure appreciate you coming on and sharing some of your research and sharing some insight with us on this topic. Thanks for joining us here today on First at 4.
Thank you so much.